genetic counselor is a healthcare provider with specialization in human genetics as well as counseling. A genetic counselor goes through a person's medical history as well as their family history to try and discern if there's any risk of inherited disease. A genetic counselor can provide information and support so a patient understands their risks, and then the option of genetic testing. A patient can meet with a genetic counselor for a variety of reasons. Here at the Lax Cancer Center, we offer genetic counseling for patients with a personal or family history of cancer that they're concerned about, a strong family history of breast or colon cancer, and a family history of young cancers as well. For patients who are concerned about their future risk of cancer, we can actually provide increased screening if we do know that there's inherited risk for them. So if someone does have what we refer to as a genetic mutation that predisposes them to cancer, we can do increased surveillance and we can try and catch these cancers early. And some patients actually choose to do preventative surgeries to reduce that risk almost to zero. Genetic counseling focuses on being non-directive, so informing patients as much as we can, giving them all the information and empowering them to make their own decisions. If genetic testing is deemed appropriate for a patient and the patient decides they would like to proceed, then it's usually a simple blood draw, just like any other blood draw. The average genetic test is run on 1 to 2 vials of blood, and we're able to isolate the DNA from that sample. If patients prefer, saliva can often be used. Cancer genetics is a field that is always growing. We are always discovering new information about human DNA and about genes that can be responsible for hereditary cancer. So every year we expect to know more and more information about the way our genetics plays a role in cancer diagnosis and be able to offer better testing and surveillance to more people.